Chronic inflammation is emerging as a core health problem in modern society. Chronic inflammation is not just inflammation, but a condition in which inflammation occurs continuously in various parts of the body, which can be the cause of various diseases. In this article, we will learn more about the nature, causes, and how to prevent and manage chronic inflammation. 1. Basics of inflammation. Inflammation is a process in which the body responds to external stimuli, and the body's immune system is activated to protect cells and repair damage. Inflammation is divided into acute inflammation and chronic inflammation. Acute inflammation. Acute inflammation is a rapid immune response to infection, injury, or invasion of harmful substances. It usually occurs for a short period of time, and helps resolve the problem and the recovery process. Acute inflammation can be accompanied by symptoms such as pain, fever, and swelling. Chronic inflammation. Chronic inflammation is a condition in which the inflammatory response persists over a long period of time. This means that inflammation occurs chronically in various parts of the body, disrupting the body's normal function and can be the cause of various diseases. 2. Causes of chronic inflammation. There are many causes of chronic inflammation, and many factors interact to contribute to the persistence of inflammation. The main causes include obesity. Obesity is closely related to chronic inflammation. Fat cells secrete inflammatory substances, which can cause systemic inflammation. In particular, abdominal obesity plays a major role in increasing inflammation. Diet. Processed foods, high-fat, high-sugar foods can cause inflammation. On the other hand, foods rich in antioxidants and anti-inflammatory substances can help reduce inflammation. Stress. Chronic stress induces an inflammatory response, which can lead to an imbalance in the immune system. Stress can worsen inflammation by increasing the secretion of stress hormones such as cortisol. Environmental factors. Air pollution, chemicals, and other environmental factors can also cause chronic inflammation. These environmental stresses can induce an inflammatory response and worsen chronic inflammation. Other health problems. Diabetes, cardiovascular disease, and autoimmune diseases can cause or worsen chronic inflammation. These diseases contribute to the persistence of inflammation, which can further worsen your health. 3. Effects of chronic inflammation. Chronic inflammation has a wide range of effects on many parts of the body, and can be the cause of a variety of diseases. The main effects are as follows. Cardiovascular disease. Chronic inflammation can cause cardiovascular diseases such as atherosclerosis. Inflammation causes plaque to build up on the walls of blood vessels, which blocks blood flow and increases the risk of heart disease and stroke. Diabetes. Chronic inflammation can increase the risk of type 2 diabetes by inducing insulin resistance. As inflammation worsens, it can make it harder to control blood sugar and increase the risk of developing diabetes. Cancer. Chronic inflammation may be associated with the development of cancer. Inflammation can cause genetic damage to cells, which can promote the creation of cancer cells. Long-term inflammation can be a significant factor in increasing the risk of cancer. Arthritis. Chronic inflammation can cause autoimmune diseases such as rheumatoid arthritis. Inflammation causes joint damage and pain, which can reduce mobility and quality of life. Neurological diseases. Chronic inflammation can be associated with neurological diseases, such as Alzheimer's disease. Inflammation triggers an inflammatory response in the brain, which can lead to damage to nerve cells. 4. Preventing and managing chronic inflammation. Lifestyle changes are necessary to prevent and manage chronic inflammation. Here are some ways to reduce chronic inflammation. Healthy eating. A balanced diet that includes anti-inflammatory foods can help reduce inflammation. Eat plenty of vegetables, fruits, nuts, and foods rich in omega-3 fatty acids. Avoid processed foods and high-sugar, high-fat foods. Regular exercise. Regular exercise can reduce inflammation and improve your health. Aerobic and resistance exercise are effective in strengthening the immune system and reducing inflammation. Stress management. It is important to manage stress effectively. Stress management techniques such as meditation, yoga, and deep breathing can help reduce inflammation. Get enough sleep. Adequate sleep is important for regulating the immune system and inflammatory responses. Getting 7 to 9 hours of quality sleep can help reduce inflammation. Manage environmental factors. It is important to manage environmental factors, such as air pollution and chemicals. If possible, it is recommended to live in a clean environment and reduce exposure to chemicals. Regular health checkups. Regular health checkups can help detect and manage health problems related to inflammation early. Health checkups can help identify the cause of chronic inflammation and provide appropriate treatment. Chronic inflammation is one of the major causes of many health problems in modern society. Inflammation can cause various diseases such as cardiovascular disease, diabetes, cancer, arthritis, and neurological diseases, and our lifestyle habits have a significant impact on chronic inflammation. You can prevent and manage chronic inflammation through healthy eating habits, regular exercise, stress management, sufficient sleep, management of environmental factors, and regular health checkups. This approach will help improve your overall health and reduce your risk of disease.